Good morning, good afternoon, and good evening, wherever you are. This is Bill Maddox in Durham, New Hampshire, USA, for the last of a series of SMDP-PLAN International webinars. We're very excited to be here today with three great guests and a topic which I think obviously there's a lot of interest in. We had almost a record number of people register for today's webinar, and hopefully you'll all be able to participate. We have a limited license, and sometimes the license is a lower ceiling than the number of participants, but we'll cross our fingers and hope everybody will be able to participate. A few housekeeping rules just to let you know. If you would like to ask questions, there is a chat box that you should be able to find, and you can type your questions into that chat box, and you'll be able to ask questions really immediately. You can ask questions as we go along, and then when we get near the end of the webinar, we will open it up. We really would like some great discussion on this particular topic. At the end of the webinar, I'm also going to give you a little bit of update on a couple of SMDP things, including the large archive of previous webinars that we have. And I'd like to say right now that it's been really a pleasure to work with John Schiller over the past year and many of his colleagues from PLAN to highlight some of the incredible work that PLAN is doing around savings groups, and hope to continue the partnership with PLAN as we go forward. Our topic today, the impact of Savings Group Plus, what evidence do we need, is a topic that is really, for many savings group practitioners, a very important issue. Savings group programs have incorporated a wide variety of add-ons to the standard saving credit model. We see savings groups providing HIV/AIDS to support vulnerable populations, malaria prevention and other health interventions, financial and business education, and youth entrepreneurial assistance. While it's not difficult to find savings group programs using Savings Group Plus methodologies, it's difficult to find rigorous evidence for positive impact from these interventions. In 2015, FHI 360's ASPIRES, which is Accelerating Strategies for Practical Innovation and Research and Economic Strengthening, that's a long acronym, program conducted a systemic review of the evidence available on Savings Group Plus programming. It found that the evidence base is small and much work still needs to be done to determine the effectiveness of Savings Group Plus programs. A year ago, a lot of us were together in Lusaka, Zambia for the SG 2015 conference. And at that conference, over 400 practitioners, financial service providers, donors, and other stakeholders brainstorm on what future savings group research should examine. What we want to know about savings groups, a limited circulation practitioner-led research agenda issued after the conference made the case that a proof of concept of the effectiveness and impact of using savings groups as a platform for other services is needed to serve as a reference point for future programming. The proof of concept would also contribute to the discussion of integration that's currently attracting attention in the wider field of international development, highlighting the best role that savings groups should play in multi-sector programming. So why hasn't more research been conducted on the impacts of Savings Group Plus programs? And what are the important questions we need answers to? And how does the Savings Group field bang the drum for more donor support for this kind of research? This is what we're going to talk about today. I'm really happy to introduce as our panelist Janine Carmichael. Janine has over 15 years of experience in international development, focused in economic development and gender, including field experience in Eastern Europe. Ms. Carmichael is Deputy Director of Accelerating Strategies for Practical Innovation, Research, and Strengthening. I could have just said ASPIRES, but in any event, we're very glad to have Janine with us today. We also have Megan Gash. Megan is a research director at Freedom from Hunger. She works closely with partner organizations to design, implement, and analyze research that measures the efficacy of Freedom from Hunger's programs in Africa, Asia, and Latin America. Her recent research focuses on savings groups, women's empowerment, resilience, and food security. In 2013, Megan was awarded the Practitioner of the Year by the SEEP Network. Very happy to have Megan here. And finally, John Schiller, who has been a frequent co-moderator of this series. John is PLAN's global advisor for savings groups, responsible for promoting the methodology throughout PLAN's 51 program countries and 20 national organizations. Prior to this role, he worked for 5 years with PLAN's West Africa Regional Office, overseeing implementation of the region's microfinance strategy, which focused on wide dissemination and scale-up of community-based microfinance models, aimed primarily at poor women and youth. So welcome, John, Janine, and Megan to this important webinar. I think what I'd like to do to start off is to get a little feedback from all of you. This is something we do in most webinars, is to shoot a poll at you. You are going to participate by clicking on the answers, multiple choice answers that appear on the screen. I'm trying to, there we are. Here's our first poll, which you should see pop up. Is Savings Group Plus worthwhile as a development approach? Very simple yes or no question. Let's see what you think. This is a much easier poll than the one we had last week. All right, let's see the results of that poll. Bianca, I'm not seeing it. Maybe.
Sure, I can read the results. We had 27 participants say yes, that they agree it's a worthwhile as a development approach.
And how many no's?
No no's.
Well, good. It's kind of a loaded question. If you're on this webinar, you probably think it's a worthwhile approach. Okay, well, let's get into something a little more challenging here. Poll 2, in your opinion, do we know that Savings Group Plus makes positive impacts? Yes, we have the empirical evidence. Yes, we have anecdotal evidence. Yes, we just feel that it's true, or no, we don't have enough evidence. So go ahead, please vote. There's 44 of you who are participating right now in this webinar, or actually, yeah, 44. So it'd be great to see most of you participate in this poll. So as you see the poll, please pick 1, 2, 3, or 4. Give you a few more seconds. All right, so everybody's had a chance to vote. Let's hear the results, Bianca.
Okay, so we had about half of our audience participate in the poll, and 52% said yes, we have anecdotal evidence. 24% said yes, we have the empirical evidence. 14% believe that it's true, and 10% said no, we don't have enough evidence. Interesting.
All right, well, we're going to make a case for more evidence, more research, but I appreciate everybody weighing in on this, and those of you that participated in the poll. Over the past several years, there has been a lot of research done, not enough, but a lot of research done on the impacts of Savings Group Plus and FHI 360 carried out one of the few systemic reviews. So I'm happy to introduce Janine Carmichael, who is going to talk about Savings Group Plus, a review of the evidence based on this Aspire study. Janine?
Thanks very much, Bill. Hi, everyone. Just to give you a quick bit of background about the Aspires project and why we undertook this effort. Aspires is a technical assistance, research, and knowledge management oriented project funded by USAID and partially funded by PEPFAR. So we have a particular interest in vulnerable populations, especially children and other populations that are highly vulnerable to HIV. But we are not necessarily restricted to looking at those populations, which is good, because if we'd had to have been, we'd have very little to say about the evidence base for Savings Group Plus for, say, OVC. So if you could go to the next slide, Bill. I just want to introduce everyone to what a systematic review is. Most of us are familiar with literature reviews. A systematic review is a more rigorous application of a literature review approach, basically. It is a meta-analysis method that aims to gather the best available evidence and synthesize it to help draw more decisive conclusions about types of interventions. It's particularly common in evidence-based medicine. It follows a research protocol that is transparent, rigorous, and replicable, which is one of the key deviations from most literature reviews, which are generally fairly flexible in their approach. And evidence review starts out from an established set of questions and a quality of evidence rating system to examine what the state of the evidence base is. So if you can go to the next slide, Bill, I'll talk about our search parameters. We were looking for savings-led microfinance paired with any sort of development initiative. This was inclusive of all types of savings groups, including self-help groups with a clear savings focus. We looked at published and unpublished documents in English from 1996 to 2014. Next slide. And we subjected them to review under a quality of evidence rating system. There are many quality of evidence rating systems available. This is the one that our team selected. And in order to establish impact evidence, we had to make sure that there was a comparison group. So any evidence that fell, or any studies that fell outside of level 2-2 were not included in this study. So a study had to fall within level 1, level 2-1, or level 2-2 to be included. Next slide. And so the results of this were, sorry, you can go to the next slide, Bill. So we started out with an initial pool of 2,000 documents and very quickly winnowed that down to 10 through applying our various screening methods, which included having 2 reviewers examining the evidence base and determining whether the data quality was strong enough. So from a fairly large initial universe, we narrowed it down to a very small evidence base. Next slide. So our first finding from this is pretty obvious. The evidence base is limited in size. We also have mixed outcomes. The evidence for impact varies by the type of PLUS intervention, and we did find some promising preliminary findings in some areas. So I will talk a little bit more about what those are. Next slide. This is a list of the interventions that we found in the evidence grouped into high categories. There are obviously a lot of interventions that folks have tried with savings groups, but the ones that have evidence that was sufficient to meet our standards were in health, in food security, social capital, gender equity and empowerment, and child well-being and protection. Next slide, please. This is where we start looking at outcomes, and outcomes don't necessarily line up specifically to the interventions necessarily. Folks that were looking at, say, child well-being might have looked at a range of other impacts. So if you're looking at this and thinking that the outcomes don't map onto the interventions, they don't on a one-to-one because things like health and education, for instance, tend to be of broad interest in how a household is doing. So we have more studies looking at, say, health outcomes than we're actually practicing health-related interventions. So in particular, looking at health, it was assessed in 4 studies, and the findings were mixed overall. We felt that there were particularly positive findings for health education and demand creation. So people who participated in savings group plus interventions saw increases in health knowledge and increases in their demand for and use of health services. Behavior change was promising. It was mixed, but tending toward the positive. But then actually making the transition from behavior change to behaviors is a challenge. And we saw a lot of no impact in preventative behaviors. Things kind of trending in the right direction, but not quite getting there. This negative finding on current ART use, we suspect that that's a sampling issue, and the authors of the study who wrote it up suspect that it is also a sampling issue. So we don't consider this particularly significant as a finding. Needed to note it here for thoroughness' sake.
Janine, just for those who don't know what ART is, could you just define that term?
Oh, yeah, sorry. That's antiretroviral therapy. That is the medication that people who have HIV take to suppress the virus. Next slide. Food security and nutrition outcomes were also assessed in 4 studies. 3 of them found positive effects on food security. One of those studies looked a little bit deeper into their food security results and found that Savings Group Plus had an impact on the amount of food that a household ate, but not on the dietary diversity of that household or on children's dietary diversity or children's nutrition indicators. So while there were positive effects on household security looked at fairly broadly, when you drilled down, there was less evidence of impact. And this finding on the negative disparity in food security is a pretty nuanced one. It was comparing, it was actually a measure of relative deprivation for OBC households. And again, there were sampling issues in this study, so it's hard to say how significant it really is as a negative finding. For child protection and well-being outcomes were also looked at in 4 studies. The findings here were very mixed. The majority of findings were no impact, and the majority of no impact findings were also education ones. So we did not find significant evidence that children were, say, going to school or doing better in school. We did see positive impacts on child labor, spending on children's clothing, and caregiver attitudes and practices toward child health, but mixed impacts on child well-being, on parental discipline, and children's mental health. There was one negative finding in this study, which was decreased spending on children's health. The authors of that study did not have a theory as to why that might be the case. They just observed it, but did not have, did not report on any thoughts as to why this might be. Next slide. Gender outcomes were assessed in 3 studies and were mostly positive. There were no negative impacts observed, and the broadest area of divergence was in intimate partner violence. One study found no impacts, one found a mix of positive and no impacts on several indicators related to intimate partner violence, and one found positive impacts. I think it's worth noting here that this was, all 3 of these were discussion or training-based curricula, and that seems to have been effective with the Savings Group methodology. Next slide. And finally, economic strengthening outcomes. What's interesting to me here is that not all of the studies reported on the financial or economic impacts of the programming. The vast majority of it, but a couple didn't, and it seems curious to me that the authors didn't see fit to comment on, or the program might not have measured what the financial effects of savings groups were. The majority of outcomes were positive, including one finding positive effects on household poverty, and one that found improved income effects. Assets and investments were more mixed. There were positive effects in 2 studies, and one study found mostly no impact. There was one study that looked at Savings Group Plus participants and found that they had better economic outcomes than Savings Group only participants, but this was not a significant result. And we did not find anyone reporting that they examined whether the savings group plus had less economic impact than savings group only. So that is an outstanding question at this point. Next slide, please. So our conclusions are that we are limited in the conclusions that we can draw because of the small evidence base and the lack of comparability across studies. So more rigorous research is needed. We note that it's encouraging that savings group plus outcomes in economic strengthening and food security largely track with the larger evidence base on savings group only. So it seems that, you know, savings groups continue to work even when you put another intervention with them. That health education and health services demand creation appear to work well with savings groups, and that evidence for savings group plus initiatives focused on behavior change and changing social norms is promising, but could use more investigation, particularly of the mechanics of how it works and where the thresholds for change are, in order to better inform programming in that area. Next slide. So our recommendations are that we need more rigorous study design in Savings Group Plus. We need to expand the evidence base of rigorous studies. So we need more randomized control trials and quasi-experimental designs. We need more robust measurement tools and longer study time periods. Standardized indicators for the plus interventions would be helpful here. It's hard to extrapolate much from the database that we have, in part because so many different indicators were used for different plus interventions. And some of this might not be a fully surmountable problem, because indicators should also be in part determined by context. So comparability is just kind of always going to be a challenge. Programs using standardized indicators for their plus intervention help. And then longitudinal designs to observe long-term effects, especially in areas where we're trying to affect behavior change. You kind of need a long time horizon to get there. And a lot of our studies were operating in the 1 to 2 years time frame. One thing that was not particularly well documented in the evidence was what the theories of change of these programs were. And that would really help if when writing up study results, you talk about what the intention of the program was and what it was trying to measure. So, you know, did the impacts that you wanted to see happen or not, and why not? And factorial research, which is would also help contribute to this. In most cases, we were looking at a comparison group, the comparison group and the intervention group were either no intervention at all versus SG plus, or SG plus versus SG only. So most studies were missing a piece that was either no intervention or the plus intervention only. So it's hard to say from this evidence base whether savings groups are successful, whether the plus is successful, or whether we are seeing a greater impact out of combining savings groups and plus interventions. And finally, implementation and cost research. We have very little evidence on cost effectiveness and cost benefits. Even if, for instance, savings group plus is more costly, which makes sense because integrated interventions often are, we don't know whether that additional cost is bringing additional value. And we are lacking evidence on the effectiveness of integration approaches. We don't have any evidence to really say, is it better if 2 organizations with separate areas of expertise implement the savings group and the plus distinctly? Is it better for one organization with specialized staff to do that implementation, or is it better if it's a unified delivery where it's all coming through one organization and one staff member?
Thank you, Janine. I think it's interesting that on one hand, you know, we're needing to have studies that are more longer term in terms of being able to look at what impacts take place. We know savings groups take a while to mature, and usually two or three cycles is what's needed really till they hit their stride. And on the other hand, you know, we just mentioned the kind of lack of you know, factorial research, that there isn't we don't have the kind of comparison studies that you'd get out of an RCT or something like that, which are, you know, to do those over long periods of times are very expensive. So there's kind of some countervailing forces here that are pretty interesting in terms of thinking about what kind of research we would need. I wanted to ask you one question that just popped up from Andreas Spaeth. He asked, how did you delineate savings groups only and savings group plus groups? Or savings group plus groups. How did you?
That was done by examining what the research teams said were their interventions. And so in some cases, they would have a control group that was no intervention. So nobody got the savings group or the plus. And then they would have the intervention package, which was typically savings group plus. And then in some cases they had, say, a savings group program, and the folks there were split, and some received savings group intervention and some received the savings group plus another intervention. Oh, and one note that I should have made earlier in the presentation that this brings up is that for purposes of this particular research, we define savings group plus as the plus as a non-financial development intervention. So we did not consider things like bank linkages or financial capabilities training to be pluses. That is not a universal definition. That is the definition that we used.
Okay, great. Well, thank you, Janine. Really appreciate this. I think, you know, since it's one of the few times that a large body of research has been looked at through this systematic review, I think it calls the need to do more systematic reviews in other areas of savings group research.
Yeah, this is the only SG plus one that we know about.
Mm-hmm. So obviously there's room for more, and looking deeper and going deeper in understanding how these interventions work. For many of us who were in Lusaka last year, we participated in a very large brainstorming process led by SEEP to help us to understand, you know, what the vast interest areas are for practitioners who are doing savings group work. What kind of questions do we want to learn about? So I'm really happy to introduce Megan Gash, who is working with the SEEP Network Savings-Led Working Group. And we'll be working with a new initiative that has just been launched by SEEP, which is the Savings Group Evidence and Learning Project, where I think I probably left out part of the acronym there, but it's a new initiative that I think is going to have an important research component, particularly in terms of looking at research that's going to help practitioners design and implement more effective programs. So I'm happy to have Megan talk to us about the practitioner-led research agenda for savings groups that came out of this very thorough process that SEEP has done.
Great, thanks, Bill. Good morning, everybody. Could you go ahead and advance to the next slide? All right, so taking some of Janine's recommendations and conclusions on this whole idea that we need more evidence. I'd like to speak a little bit to that today, sort of zooming out and talking about broader questions in general for looking at savings group programming. So as Bill mentioned, the brainstorming that happened at the Lusaka conference culminated in a report that the SEEP network published back in September. It was released at the SEEP annual conference, and it's called a Practitioner-Led Research Agenda for Savings Groups. And it's a 15 or 16-page document, and it talks about what are some of the key questions, both operational and impact questions, that fall under a variety of areas. And one of those areas, of course, is savings group plus or integrating savings groups with other development services. It also includes access and use of formal financial services, building capacity for quality groups, savings groups in a digital age, and outreach to vulnerable and harder to reach populations. So, so regarding the questions that are relevant to integrating savings groups with other development services, of course, when you bring a lot of practitioners together, they want to talk a lot about operational issues, not just impact. So the two big questions that came out are around operations. What are the best practices to integrate other development services into savings groups? And then also, what impact does this have on members and their families? So could you go ahead and go to the next slide? All right, so starting with impact questions. So again, this reiterates one of the points that Janine made, but so what is the theory of change behind the addition of other development services? So what benefits, what are the expected benefits for members? I think it's good for savings group practitioners and other researchers to think about, well, if we're adding these additional services, whether it's advocacy services or like agricultural training or health services, what do you expect the members to get out of that, and how do you expect it to impact themselves as well as their families, their households, and to put that down on paper. I mean, I know it's something that we sort of, as practitioners, we automatically assume, well, if you add health services, you're going to see improvements in health. But if you really sit down and break down that a little bit further, I think it really helps in understanding which parts of the program that you're adding will impact which areas of their lives. So again, in a more general sense, you know, which services would lead to which outcomes, and then how would these outcomes evolve over time, as well as, you know, how are these impacts sustained over time. Next, the question is, what's the impact of integrating other services on the group? So what's the impact on the group's financial performance, on the internal management and collective activity? So if you add these other services, do they help strengthen the group? Do they have a negative impact on the group quality? Is it sort of a neutral effect? Like, is the group still functioning as it would by itself with these additional services? And then third, what is the use, or is the use of savings groups as a platform for other development services more effective than providing them separately in terms of impact? For instance, if you add health services, like you connect health services to a savings group, is there some sort of like combined, is there something about that combination of adding the two that, you know, increases the impact, or does it take away from it? You know, which works better? Do they work well combined, or would they work better separately? I think we automatically assume they work better combined, or at least that you're increasing access to more people by combining them. But taking a closer look at really understanding that, I think, is a worthwhile exercise. Go ahead and go to the next slide. And then in terms of operational questions, what are the core principles and procedures for successfully integrating other services? How do you sequence services? What are the main lessons pulled out of sequencing? What are the different models for adding them? You know, do you integrate them? Do you add them at a later time? And then who provides the service? Is it a matter of an outside actor that manages that development service to come in and connect with the groups, or should a facilitating agency that form the groups, or the community agent that form the groups, should they be facilitating the service? Should they be delivering education of some sort to the members, for instance? I think this here is the #1 question that we ran across in the brainstorming. It's that practitioners really want to know, how do you do this? How do you do this well? So also, what are practical ways to protect the integrity and quality of a savings group while adding the service? So what are the guidelines to help make sure that the savings group stays a high quality group? Do you limit the number of services? Are there specific guidelines? Does connecting it to a service promote dependence on the service? Are there any consumer protection concerns in terms of, like, is there anything about the additional service being offered that could threaten the group just in the nature of the service itself? Excuse me. Should linkages to other services be maintained over time? Is it possible to do that? Is it financially possible? Is the nature of the development service something that needs to continuously be accessible to the group members? And then lastly, what are the cost implications for these various models? What's the cost for the facilitating agency, for the service provider, for the savings group? Will savings group members pay for services? Who should bear the cost of making this connection work? And go ahead and go to the next slide. All right, and then of course, you know, as researchers often do, there's definitely a call for more evidence here. And then as Bill mentioned earlier, I think what would be really helpful is this proof of concept. And I think since we've seen multiple interventions where savings groups added additional services, I think we think, well, if it worked once, then that means that it works. But I think the industry could really benefit from something that's documented, that's more nuanced than that. And maybe what it is that we need something that's more of a technical guide that gives recommendations around the best practices, how do you maintain the group quality, a discussion of the different ways to sequence it, for instance, and cost implications as well. Because what we really want to do is show not just savings group practitioners, but also practitioners in other sectors of development that these programs can be added in this way, and it can provide positive impacts. Or if it doesn't, you know, what are the key things that determine whether you can get positive impacts or not? And then how can you apply that to other programs? For instance, the graduation model. Like, how does it work well to have savings groups? Like, for instance, we know that there are graduation models out there that have savings groups as a component, but what is it about the way that function that makes it function well? And then also the issue I brought up earlier, if you have this combination of services of savings groups, which is a financial service essentially, and then you add on these other development services, is there some other additional benefit you get or additional impact from combining it all? So I just like to make the call for that I think I think there's a need for it in the industry. And again, like, even if it came in the form of some sort of a technical guide that gave recommendations, I think that could be quite useful. And then we'll talk about this a little bit later, but I think it's good to share if there's any other research going on with the practitioners that have logged into this. Actually, I could even, later when we get into the discussion, Freedom from Hunger, for instance, we have a study going on where we're taking a look at comparing savings groups alone to savings groups plus agricultural interventions. So we'll have a comparison where we'll understand just the impact of the plus part of it. But we want to know, are there other studies like that that are going on right now? And then if you've got anything to share at this time, we encourage you to contribute it to the SEEP database, which to me I think is one of the best, if not the best, depository for savings group research at this time. So I just want to make that plug. I think it's a great resource. All right. Well.
Great. And we will provide some information to everybody about how to connect with SEEP, and specifically how to connect with the how to access or add to the database. The new Savings Group Evidence and Learning Initiative, SAGELI, I think is the acronym, is one of its functions is really to provide that kind of one-stop place for people who are looking for previous research that's been done to help understand how you can better design programs, make your programs more effective. So we really appreciate the efforts of SEEP, and I really appreciate your contribution to that process, Megan, as we move forward in this really exciting field. We're going to turn it over now to John Schiller, who is going to give us some of his thoughts of someone who's been involved in this field for a long time and has a senior position within PLAN overseeing savings groups globally, to give us some final thoughts on the need for more evidence in Savings Group Plus. John?
Thank you, Bill, and good day, everybody. These are just some observations that have come from PLAN's work. they would come under the heading, I guess, of anecdotal evidence. There's no rigorous research behind any of these thoughts. The first one is that to increase the impact, our hypothesis is that you need to design for impact, and by that we mean that there needs to be a period of consultation between whatever project it is that's using savings groups and savings groups plus and the community on what the goal of the group actually is. And we had an example of this, or we have an example of this from Togo, where we, for years, had a very successful savings group standalone program, which attracted many members, had very low dropout rates, had very good financial performance indicators. And at the same time, a new project was introduced, which was promoting health insurance cooperatives, being managed by the health technical advisor of the country program, and where there was little coordination between the two. The health insurance cooperative program was having difficulty convincing people that the insurance was a good thing, and people were saying, "Well, we don't have the means to pay the share contribution to join the cooperative and then to pay the premiums." So the two sides finally got together, the savings group side and the health side, and determined that if savings groups were promoted in communities where the health cooperatives were also being promoted, that you could make an argument that one would help the other, and that in fact both would help each other. And this was done, and the result was much greater acceptance of membership in the cooperatives. So again, just an example of how consulting with communities and sort of explaining a rationale between or behind what the savings groups could solve in the way of problems or could address in the way of issues might result in greater impact. A second thought is with respect to savings group quality. In our experience, savings groups were pretty much a standalone intervention for many years until people saw what the great benefits of them were. And other sectors then began to embed them in multi-sectoral programmings or in programs where the social impact and the social intervention was much stronger than the savings group intervention. And when I say stronger, I mean in terms of budget, technical attention, and expected outcomes. And what we found, or what we're finding, is that often the savings groups suffer as a result, because the emphasis is so much on whatever the social outcome is that the savings group is sort of seen as an automatic add-on. That is, if you add it on, it will therefore succeed and will help you achieve your other social objectives, and that not enough technical attention is being given to setting up quality groups. Often the groups are weak, and because they're weak, of course, they don't produce the benefits. So if you're evaluating this kind of a project and you're not seeing much in the way of synergy between the savings groups and the plus activities, you may conclude that the mixture of the two is not successful. Where in fact the problem is that the groups are not being strengthened to the point where they can produce the benefits that would then complement the other interventions, the social interventions. And then finally, and this is a point that Janine made quite well, which we took this term premature evaluation from a recent blog by Oxfam's Duncan Green, and I think Bill, you can provide the link later for those that would like to read the article. that say a 3-year project may not be long enough to demonstrate real impact. And that a 3-year project, in terms of conducting a baseline and an end line and involving a control group, may result in a much narrower period for comparison because of the time it takes, and this has been our experience, the time it takes to organize a baseline data collection exercise, an end line data collection exercise. Often the intervening time is very, very short, and probably not enough time for the groups and for the other interventions to really kick in and produce their maximum benefit. So again, these are 3 thoughts which we think could contribute to eventual impact of Savings Groups Plus programs, and could enter into the research protocols for future research. Thank you, Bill.
Great, thank you, John. I really appreciate your thoughts. And as John mentioned, I will provide the link to the Duncan Green article. So now we have a number of questions that we can turn to, but for those of you out there that have done Savings Group Plus research, what have you done, or what are you doing, and would you be willing to share that with us right now? Also, while we've been talking, David Panetta, who is the new director of the SEEP Savings Group Evidence and Learning Initiative, has graciously posted the link. If you look in your webinar chat box, you can see the link. And it says, to make a submission to the Savings Group Resource Library, please contact SEEP Savings-led Savings-led Financial Services Working Group. And the email address is there. And we'll make sure to include those in the archive information and actually email it to everybody who registered for today's webinar. So let's turn to some of the questions that came in. So this is from our friend Berkey Masheka in DRC, and he asks, hi, what do you think the behavior change is most associated to in the implementation of Savings Groups Plus? That's something somebody wants to tackle?
Sure, I'll jump in. Maybe Janine, you want to add to it. But I mean, my gut reaction is that it really has a lot to do with the Plus. Like, how is the Plus designed? What is it? What mechanisms in it can instigate behavior change? And is it delivered in a quality manner, so to speak? Is it delivered well? So it's a high quality program for the and effective program for the members. But I think it really comes down to how the Plus is designed and what is the Plus.
Mm-hmm. John or Janine, do you have any thoughts on that, or I can go on to the next question?
I just would agree. I think again, involving communities in the discussion before the Plus is decided on, for us, is a very determining factor. It can really influence how people use the money that they're earning as a result of being a member.
Mm-hmm.
And I would say,
I'm sorry, Janine.
Sorry, Bill. I would say that there, I think, are 2 factors to consider to understanding behavior change better. And one is in the rigorous research that we're aiming for, to include qualitative work to help examine not only whether things happened, but how and why. I think that will help us understand the results better. And another factor is the Plus intervention that aims at behavior change, is there any evidence for the effectiveness of that intervention on its own? Because, I mean, as a whole, as a field, we're I think, addressing evidence gaps in a lot of areas. But if we're combining an unproven methodology with Savings Plus, then it maybe should not be surprising that we're not seeing the effects that we want to see.
Mm-hmm.
Mm-hmm.
Thanks. This is from Shakir Mashawala. He asks, can you give specific examples of what kinds of services integrate / work well with savings groups?
I would say that from the study that we did, which again I would highlight as a limited universe since we focused so strongly on robust evidence, that the interventions that seemed to pair well were discussion or education based, which makes a lot of sense when you think about the fact that you have a group of people who are coming together on a regular basis. This is part of the draw that savings groups have for other interventions, is that there is an incentive for people to get and it creates a group that you can intervene with fairly readily. In terms of appropriateness of that intervention, though, that really depends on how homogeneous are the group's needs. Does everybody need a particular intervention? So I think we don't have the evidence yet to generalize particularly strongly about what types of interventions have worked well, but I would say that the strongest evidence from our review has come out in areas like discussion or training and education based initiatives.
Yeah, if I could give a specific example there, our most successful combination has been savings groups and entrepreneurship training. We used a curriculum that we developed with Making Sense International called Enterprise Your Life, which we've talked about on other webinars. But this produced very high levels of enthusiasm among young people. The program in question was targeted at youth. And the fact that this was introduced after the groups had attained a certain level of maturity and were asking the question, what can we do with our money and what's next besides just saving and borrowing? And because it was focused on the development of life skills that are linked to successful enterprise management, resulted in a great deal of enthusiasm. And I think our theory is that this enthusiasm kept people in the groups. There was a very low dropout rate, almost no group dissolution. And people ended the program with a very positive outlook and many economic activities that they'd started to sustain them.
Thank you, David. John. Here's a question, actually a couple of quick questions. Question for Janine. Is the full systematic review study available? And if not, will it be available?
We are trying to get that in a peer-reviewed publication. So it is not available yet. We hope it will be available soon. And once it's in, once it hopefully is accepted, then we are able to publish the larger report. But for now, it's in a few months before the study results are available, at least.
Okay, and also Laura Ellis asked Megan, can we expect to see the Freedom from Hunger's findings on their comparative study?
So we'll have a baseline report that does some extra analysis that most baseline reports don't do in maybe around February of 2017, but then the end line that really looks at the full impact of the program probably wouldn't be available until about a year later, like February of 2018. Right,
so you can get the work done. So a couple more quick questions. This is from Nafis Mudassir. I'm interested to know, in the theory of change for Savings Group Plus, what is the impact being expected and how they can be linked to employment? I don't think
that's it.
That's a tough question.
Yeah, no, I think that's a really good question. One thing I will mention so I think there, in some individual practitioner authored reports, they'll include theories of change just for savings groups in general. And I can't think of one specifically off the top of my mind, except the SEEP published an evidence-based story of savings groups at the synthesis of the 7 randomized controlled trials. And at the end of that document, there is a more generalized theory of change for savings groups that looks at what are the expected impacts for the length of time in a savings group. So that, I think, is a really good place to start in terms of what are the expected outcomes. And then in terms of the, what's expected for the additional service, that really has to come down to what the service is, because you're going to have a different impact with a health program versus business training versus agricultural training, et cetera. So it's almost like you have to look at 2 different theories of change and kind of find a way to combine.
Sure. And that's kind of the challenge of 7 groups plus in general.
Mm-hmm.
So here's a comment from David Panetta, or maybe it's a question, I'm sorry. Are generalized conclusions even possible given the infinite universe of the plus, the theme approach, model, quality of implementation, contextual factors, et cetera? Or is the most we can say is that for a specific intervention, these are good practices and expected results?
I would say, honestly, at this point, there's really very little that we can say based on an analysis of the rigorous evidence base. Just because it's so small and it's so varied, and we need so much more research to fill in the gaps. And I mean, even what we have right now is so limited. It's another study done could completely overturn our results in some areas, and then we would have a 50-50 evidence base. So like the things that we're saying we think based on the evidence right now are pretty robust, still need more study because the evidence base is so limited. So I would say that the point in time that we are at is one where it is very hard to make generalizations for a lot of reasons.
Right, you just don't have that big of a base.
Yeah, but I will add that though, I think it's actually really interesting, the point that you made earlier, Janine, that it seems like programs that have some sort of a training or dialogue or education base to them or significant component, have led to some positive outcomes, or at least they're the more effective ones. Like even if that's not like fully proven, just the theory that is an important part of it. I mean, it makes sense thinking of the way that groups work together and that they exchange ideas and they talk a lot, and there's a big social capital component like within the group itself. I think that's really interesting. I mean, we're just starting to get into this, but I think that could prove to be completely true. And I think there's other things we could pull out of it. So I would say it is, since there's so little evidence, it is easy to think, well, it depends so much on the composition of the PLUS program. But I think the farther we get in, we could start to make more generalizations like that. Yeah. I also think we could also come up with some, do not do this principles as well. Like, I think we're so attuned to here's what it takes to make a quality group that we forget that we already know, don't do this or it'll break up the group, or don't do this because it'll lead to poor group quality, that sort of thing. I think there are already lessons like that we're not even thinking of that we know.
Yeah. Understanding the mechanics of both interventions and, again, the theory of change for why we think they should work together, I think is really important. I think there's an interesting area to look at too is investigating whether there are places that have the capacity to enhance savings group function. Like it kind of comes out with out of what Megan was saying about discussion and things like that. If you're enhancing group solidarity and members' knowledge of and trust in each other, does that make for a better savings group?
Right, for sure. I just want to let listeners of the broadcast know we're going to go slightly over. I'm going to ask one more question and then go to some quick announcements. So just a little bit over. This is from Jason Pope. In child protection, was there a difference in the projects that designed savings groups for children participants and ones that only promoted savings groups for parents on the outcomes of children?
In our review, there were only caregiver groups. There were no child savings groups.
Okay. And John, do you have any experience with that, or?
We do have experience with child groups, but not where there was a plus component. So
right, okay.
we've been able to show that you can have children's groups that work but no impact beyond that.
All right. Well, this has really been an interesting discussion. It obviously underscores the need for more research, not only in Savings Group Plus, but in general, to understand a lot of the dynamics of what makes good Savings Group programming, what is the mechanism of social capital building within savings groups to improve program quality, what happens to groups over long periods of time as they mature. There's many questions. Many of this came out of the, that are actually contained in the what we want to know about savings groups, which I'll see if we can actually publish that also, and I'll send a link to people if we're able to do that. I want to thank John and Megan and Janine for joining us today. I think it's been really useful for a discussion that obviously needs to continue and to expand, and we hope the kind of donor support and practitioner support for increasing the body of research out there will be strong, because we really we want to know how to make these programs as effective as possible. I want to just briefly, before we wrap up the webinar, let you know that we record all of our webinars. We usually put, along with the recordings, besides a PowerPoint PDF, we also include related documents. We have been doing this since 2012. I'm showing you the page right now where you can find this within CARSI. And we've also provided for you at the top of this page, you'll see all of our 37 titles of savings group, of webinars on a range of topics, not only savings groups, microfinance, market development, savings groups, social franchising, financial education, impact investing, youth financial services, and more. And our kind of list of presenters is very diverse. So you can go to this directory, find a topic you like, and then go to the archive and click on it. And all but one of the 37 webinars has been recorded. So it's a resource that you can use. The information is, I think, very valuable. And we know that there are universities and training organizations and others that integrate our webinars within their learning agenda. I'm really grateful to PLAN for supporting this webinar series in 2016, and we are going to take a hiatus for a little while as we work on other areas, but we invite you to stay in touch. You'll be on the mailing list for future SMDP webinars, and we hope you'll be able to join us. I want to thank today's guests and everyone who joined us in this webinar. And I wish you a good morning, good afternoon, or good evening, wherever you are. Thank you very much.
Thanks, everyone.
Thank you.
Thank you. Thank you.